friends, and welcome to Srishti News. Today we have Dr. Anagha Heroor with us, who is the medical director of Anil High Hospital and an eye specialist also. Hello, doctor.
Hello.
Doctor, please tell us something about Anil High Hospital, about the establishment of Anil High Hospital, please.
Yeah. Anagha Hospital was first established by my mother-in-law, Dr. Anagha Heroor. This was in 1972, and I joined in 1997. And since then, we have added more and more latest technological investigation and therapeutic modalities to the hospital, including the latest LASIK surgery that we are doing nowadays here. And we have a very good team of eye specialists, including a vitreoretinal doctor, a squint surgeon. We have our associates who are helping us with the general ophthalmological patients. We have a team of caring staff, and recently we have been awarded the excellent grade in the ISO 9001-2008 certification, as well as the ASNH certification, which very few eye hospitals are having now.
That's wonderful, and congratulations to you for it. Yes, ma'am. Please tell us something about LASIK. Today, everybody wants to get rid of the glasses that we wear. So, how safe is LASIK, and at what age can one go for a LASIK operation?
Yeah, you're right. Today, LASIK has become a craze. At the same time, we need to know that all people who wear high numbered glasses and who are dependent on glasses, their lifestyle is totally changed because of their glasses or because of the contact lenses that they use as a substitute to glasses. Not that glasses were not used for so many years, they were. Then contact lens came on, by which we were using it as a substitute to glasses. However, today we can do LASIK surgery by which you can have freedom or independence from both glasses as well as lenses, which means a total improvement in your lifestyle, especially for the younger generation who are adventurous, who want to have a very active lifestyle, like for example swimming, going to water parks, skydiving, so many things. There are air hostesses or models. There are sports enthusiasts, professional photographers. There are people who want to go into the armed forces where glasses or lenses are not allowed. And in general, for everybody, I feel not being dependent on glasses and contact lenses gives you a lot of self-confidence and boosts your self-confidence in your day-to-day work. And we all need to remember that LASIK can be done for people who have completed 18 years of age and who have a stable refractive error, that means a stable number for over the last 6 months to 1 year. And as you rightly pointed out, the issue of safety, I can tell you that today with the advancing technology and with the most modern equipments that we are using, the amount of safety profile in LASIK surgery is tremendous. Okay, that is point number one. And in case there are some problems, we can identify those problems very early. There are so many tests that we can do in the eye by which we can rule out certain risky situations, so that we can avoid those situations, and patients are advised against doing LASIK if there is any kind of compromise. So what is important is, whenever a patient is worked up for LASIK, the checkup has to be done very thoroughly and from all angles, in such a way that we know almost that yes, LASIK surgery is yes. Correct.
And again in LASIK, I guess the infection that eye catches most of the time when wearing contact lenses or even glasses, that can also be avoided once LASIK.
Yes, definitely. In fact, we had a patient recently, a young diabetic in fact, was using lenses for so long, and she came with a very severe infection. So forget about LASIK, she couldn't even continue wearing lenses and her vision had dropped. So there are certain issues with contact lenses, not only infection but also dryness, the issue of maintenance. Because we need to really take care of your lenses. You cannot just wear them and throw them off. Even though we have nowadays disposable lenses, you need to remember that you need to remove them before you go to bed. And then if there's any kind of redness or some foreign body entering the eye, then it makes a big problem to the person. So contact lenses need to be taken care of, and with them there is always a risk of infection. In LASIK also there are certain issues of dryness, but nowadays with improved technology and with the lubricant eye drops that we are prescribing, that has reduced tremendously.
So now we can say that God has invented lenses and you doctors have invented LASIK. Dr. Anagha, please tell us how is LASIK performed and what are the pre and post precautions before the surgery?
Yeah, LASIK actually is a very very simple surgery for the patient. The patient is first checked thoroughly, and once all the investigations have been found to be in order, then the patient is taken into the operation theatre after cleaning the eye, and it is done under this thing called as topical anesthesia. That means just local anesthetic drops are instilled in the eyes. There is no injection, there is no sedation, there is no general anesthesia.
No cuts.
No, in the sense, topical anesthesia. That is the first step. Then, when the patient is under the operation table, a special flap is made with a microkeratome, and once the corneal flap is raised, laser is applied on the cornea so as to polish the surface, and so the flap is put back after that. Okay, all this takes around 10 minutes. So, it's around 10 minutes maximum each eye, and the patient comes out and
Sees a new world without
sees a new
glasses.
world, yes. And immediately post-operatively there could be a little pricking, watering, a little redness which lasts for around 4 to 5 hours, and after that the patient is totally comfortable. The vision improves almost more than 90% within the first 24 hours itself. Yeah, so some special drops are given, some steroid, antibiotic and lubricant drops in the post-operative period. The most important precaution that the patient needs to take is not to rub his eyes and not to splash water on open eyes. Okay, because the flap which is being made needs to be in place. It sticks automatically by capillary action, but we should not displace it. He can start all his other activities in the form of reading, computers or watching TV or going out, everything else by almost the second or the third day. Only thing is not to touch the eye, not to rub the eye, and not to splash water on open eyes.
So when the patient takes a bath also he has to be
We need to
very
be careful, especially in the first 1 or 2 weeks, and after that the patient becomes very comfortable.
So please tell us, after the surgery, does the vision completely improve or the patient still needs reading glasses to read or something? He needs glasses after the surgery also at times?
Yes, see, if the patient is around 40 years or more, yeah, all of us require reading glasses, irrespective of whether you have undergone LASIK or not. Even patients who are using glasses for distance vision or patients who are using contact lenses. Reading glasses is something called as presbyopia, in which the ligaments of the lens become a little weak. So all of us require reading glasses after 40. Similarly with LASIK the distance vision is improved totally. However, the reading glasses have to be used after surgery. However, there is a one way through it, that is in one eye, if there is a minus number, we keep the target around say -1 or so the patient can see near with that eye, with the non-dominant eye, and the dominant eye sees well for distance. So this is called as monovision. However, the patient needs to be counseled about it to make him understand what kind of vision we are giving. Otherwise, the patient should be comfortable with binocular good vision for distance. He should be ready to wear glasses for near.
So after 40 you generally recommend that the patient has to wear the reading glasses on. Dr. Anagha, please tell us something about cataract now.
See, cataract is basically the clouding of the natural crystalline lens that is inside the eye. So as we age, just like graying of hair, the lens inside the eye becomes opaque. And as the opacity goes on increasing, our vision becomes more and more blurred. So in our day-to-day activities, we tend to have difficulty in performing small things like reading or looking at someone coming from a distance or watching television. So as the vision becomes more and more blurred, there could be times when the glasses number can keep changing again and again. But in spite of changing the glass, if the vision is not improved, and we have been diagnosed as a cataract by the ophthalmologist, then comes the time when we have to undergo cataract surgery. So nowadays, with cataract surgery, people already know that there are so many kinds of lenses that can be used in the eye. A long time ago, the cataracts used to be removed by taking a bigger incision and taking a lot of stitches, but that used to delay the recovery by a longer time.
Okay.
But today we do cataract surgery by a technique called as phacoemulsification.
Okay.
Okay, and here we use a titanium probe which helps to remove the cataract, and then by just an incision of around 2.8 millimeters, we insert a foldable lens inside the eye, a lens which folds when you are inserting it and then opens up inside the eye. So the incision is very small, it is watertight, it doesn't require stitches, and it heals very fast. So the patient can be very easily and fast rehabilitated very soon. So there are a lot of advantages in using such foldable IOLs. Plus, the intraocular lenses nowadays that we use are also, a multifocal IOL that we can use. Just like we use bifocal glasses, we have lenses in which your distance, your intermediate, and your near vision all can be, taken care of. So once a multifocal intraocular lens is put in both the eyes, the patient is literally free of glasses. So it's not only the younger generation who can be free of glasses with LASIK, but also the older generations who have cataracts, who after being operated with for cataract surgery and with such special lenses can be literally free of glasses. And earlier we used to give injections, around the eye so as to numb the eye, anesthetize the eye. But nowadays we use just drops. That is again the same like LASIK surgery. We just put eye drops, anesthetic eye drops, and then we do the surgery. So even this is absolutely painless. And here again the recovery is very fast. The patient doesn't need an iPad. He can just walk home with a goggle or just, yeah. So that makes, and he usually people are very scared of the injection when they think of any eye surgery.
Anesthesia
In fact,
again.
just today, a patient whom we had just an hour ago, we operated. She came and literally fell at my feet, saying that I was so scared that when I would undergo cataract surgery, that injection that would come into my eye, so I was delaying it for the last so many months to a year. But today I underwent cataract surgery even without the injection, and I had no problem at all, and I'm so relieved today.
Okay.
So it
That's
makes
a
a lot of
wonderful,
difference to the
yeah.
patient actually.
Without pain and again without the
Yeah.
fear of the injection.
Yes.
You get healed, it's wonderfully done. So these are the new techniques which are used.
Yes, yes.
Okay. Do you think cataract can only happen once the age of 40 is crossed or something? Or in a small age also cataract has been diagnosed?
There is a condition called as congenital cataract, in which the child is born either with the cataract or develops cataract in the first few years of age. In fact, we operated a patient of 2 months who had cataract in both the eyes. At the age of 2 months, we operated the child, and today the child is almost around 5 to 6 years old and doing very well. So, with congenital cataract, the problem is it needs to be diagnosed very early and treated correctly, operated in time and operated well, so that the child has good vision for a lifetime.
Doctor, tell us something about glaucoma now. How it is diagnosed, glaucoma? Please tell us something about it.
See, glaucoma is also known as the silent killer of the eye. Okay, unlike cataract, even if a cataract matures and when we operate, we can get almost 100% vision back. Okay, but when glaucoma, what happens is the optic nerve of the eye slowly gets atrophied because the eye pressure increases. As the eye pressure increases, the optic nerve starts becoming weaker and our peripheral vision starts becoming dimmer. And finally, even the central vision is affected. So, this happens so slowly that the patient doesn't realize that he is having a problem. Because of the peripheral vision being affected first, he continues to see well in the center. And if one eye is affected earlier than the other, so when he sees with both eyes, he doesn't realize. So, in glaucoma, the most important thing is to diagnose it early. Ideally, every person above the age of 40 should get himself checked for glaucoma once every year. There are people who have had family history of glaucoma, like either your parents or your brother or sister who has glaucoma. So that person has a 2 to 4 times higher risk of getting glaucoma. So that person should be a little more careful. People who have high minus numbers, they have a thinner cornea, and that is why they may be diagnosed a little later. That is why they need to be a little more careful. People who have undergone any eye surgery or have had injuries in the eye, they may be more prone to glaucoma. But finally, every person should get himself checked for glaucoma, and that can be done by checking your eye pressure, by checking the optic nerve on the retina of the eye by an ophthalmologist. Many times we get our eyes checked at just for glasses, and that's just a superficial checking. The internal part of the eye, if it is not checked, then glaucoma can be missed. More than 90% of the people don't have any symptoms of glaucoma. It's just around 8 to 10% of people who can have eye pain or headache or redness or sudden pain and nausea, vomiting. That is when the eye pressure increases. But most of the patients in glaucoma, it is very very silent, and that is why it is called as the silent killer of the optic nerve. So then it becomes very difficult. If the diagnosis is delayed, by that time the vision has already been lost. And the worst thing about it is, whatever vision loss has occurred, we cannot get that vision back. Even after the treatment is started, we can only maintain whatever vision is remaining. We cannot get back lost vision, unlike in cataract. And that is why the earlier we detect, the more vision we are saving.
So the earlier you detect, it's better that you can cure
That
it.
is why, irrespective of whether you have any eye problem or not, any symptom or not, just like diabetics, like we say how diabetics need to get their eyes checked to rule out diabetic retinopathy, similarly for glaucoma. In fact, for the last many years we have been taking, we have developed a glaucoma support club at our hospital, and we have had meetings with the patients on World Glaucoma Day, which is March 12th every year. And we get all our patients together. We have an interactive discussion as to how they are coping up with the problem, what kind of experiences they have, and the patients share the experiences with each other, which helps
Yeah.
them a lot.
Thank you, Dr. Anagha, for giving us your valuable time.
Thank you.